We'll move along now to the last speaker before our break, which is Rini Bhatnagar from the UCD School of Public Health, Physiotherapy and Sports Science. Rini, are you there? Lovely to see you and very welcome. Thank you very much.
All right, so good morning, everyone. So today I'm presenting some of the results of the study where we focused on the ways in which children with cystic fibrosis, their parents and their families managed their day-to-day lives during COVID-19 pandemic. This study was conducted jointly between UCD and Cystic Fibrosis Ireland, the support and advocacy organization for people with CF, and I am a PhD student funded through a grant from Health Research Board. Going to the introduction about cystic fibrosis. So cystic fibrosis is an inherited chronic disease which mainly affects lungs and digestive system. It is a life-limiting autosomal recessive condition which mainly affects people from European ancestry. It is mainly caused by a gene mutation leading to dysfunction of cystic fibrosis transmembrane conductance regulator, which is CFTR protein, which leads to production of thick and sticky mucus, which in turn obstructs ducts and passageways, leading to infection and malnutrition in children. Ireland has the highest incidence of cystic fibrosis in the world, with around 25 new cases being diagnosed every year. Looking at the figure on the right, we can see that it is cystic fibrosis inheritance pattern. The red color indicates defective CF gene. Both the parents, they have to carry at least one CF gene for the child to get affected. And when both the parents are carriers, there is 1 in 4 chance of each child having CF. Moving ahead, the thick and sticky mucus in cystic fibrosis provides a very rich environment for both bacteria and makes the child very prone to various kinds of lung infections and breathing difficulties. Thickened digestive juices leads to absorption problems in children, which may further lead to digestion problems and malnutrition. The pancreatic malfunction can lead to type 1 diabetes, and disease of liver is very common amongst these group. Children with CF are also on a large number of daily medications such as antibiotics, their drugs for digestion, and also tablets for diabetes. And they also have to be given nebulizers on a very daily basis. Along with it, several physiotherapy sessions either at home by their parents or at hospitals are conducted for these children. They also have regular appointments at hospital for specialist care. Along with it, they have a multidisciplinary CF team, including dietitians, physiotherapists, respiratory therapists, etc. They all work with these children. Generally, these children have very frequent hospital visits for infective exacerbations of cystic fibrosis. Moving towards the key aims and objectives of the study. So the overall aim of the study is to assess how children with cystic fibrosis, their parents and their families manage their day-to-day lives during COVID-19 pandemic. And for this presentation, we are mainly focusing on the 4 objectives, which are reasons for delays in hospital visits of children, different ways through which GP or consultants were approached, the various precautions taken by the family and their child, and how medicines and other daily routine supplies were arranged during the pandemic. So Cystic Fibrosis Ireland conducted a survey in the last week of March to analyze the impact of new COVID-19 pandemic on CF community in Ireland. This is a follow-up survey and it is conducted by UCD in collaboration with Cystic Fibrosis Ireland. The total number of participants in this study are 242, which includes people or adults with cystic fibrosis and parents of children with cystic fibrosis. Today, we are focusing on children with cystic fibrosis and parents of children with cystic fibrosis. Moving towards the methodology of this study. So this is a cross-sectional study. A self-administered questionnaire developed by UCD and Cystic Fibrosis Ireland teams were uploaded on Smart Survey UK for a period of 6 weeks. The survey was hosted by CF Ireland and it was advertised widely via various social media platforms such as Twitter, Facebook, Instagram, and various CF WhatsApp groups. Also, a copy of participant information leaflet was made available on Cystic Fibrosis Ireland website for the participants to review. A tick obtained consent for both data collection as well as processing of data at the start of the survey after reading the participant information leaflet. Moving towards the demographic characteristics of the participants. So we can see in the pie chart on the very left that the blue color depicts that around 53% of the participants were from urban locations. In the pie chart in the middle, the green color depicts that around 54% of the children were of the ages below 10 years when COVID-19 began. And in the pie chart on the very right, the yellow slice shows that around 16% of the families were totally cocooning, which means like any family member or parent was not going out for any kind of shopping or their work, and they were getting all the essential items delivered at their homes. This slide shows the various sources of information from where parents obtain information regarding COVID-19. So the horizontal bar graph on the left shows the key sources of information, which are CF Island website, which is shown in the orange bar, the HAC website shown in the gray bar, and television, which you can see in the red bar. Looking at the pie chart on the right, we can see that around 70% of the participants were very satisfied with the information. Around 23% were a bit unsure, and a very few numbers were not satisfied with the information. Moving towards the next slide, which shows change in hospital visits. So looking at the pie chart on the left, around 55% of the parents had to defer their child's hospital visit during COVID-19. And when we look at the bar graph on the right, the horizontal one, we can see the duration of deferral was between 1 and 6 months. And majority of the parents had to defer their child's visit for a duration of 3 months. However, some had to defer for a long duration of around 6 months as well. Looking at the bar chart at the bottom, we can see the main reasons of deferral, which were fear of COVID-19 if they visit hospital. Along with it, a smaller number experienced that the hospital unit was closed. We also looked at the availability of medicines and PPE, and we found that while medicines were available for many, it is very, very important to note that around 12.4% of the participants found it challenging to access medicines and treatments for cystic fibrosis. And 1% had to even stop taking the medication and had to find an alternative. And we also looked at medicine availability by location. However, we didn't find any urban or rural difference in the numbers who had difficulties in accessing medications. Protective equipment such as masks, gloves, and hand sanitizers were available and easily accessible for around 88% of the participants. However, 10% of them still found it difficult to find. And it is also important to note that majority of the participants, around 93% of the participants, carried hand sanitizers whenever they went outdoors. Turning to the medical care during COVID-19, the graphs in the top row show the various ways through which child's health professionals were approached, and the graphs in the lower row show the usefulness of each modes of consultation. So when we look at the graph on the very top left, online consultations were new to some people. However, they found it very useful. When we look at the second graph, around 55% of the respondents received their prescriptions via email, and those who did, they were very satisfied with the prescription via email method. The third and the fourth graph shows that small number of parents and children used online education or training and exercise and physiotherapy classes, but those who did, they found it very useful. Online physiotherapy sessions were taken more by the parents of newly diagnosed children, that is, children below the age of 1 year, than the parents of children above 1 year. Focusing on the precautions taken by the families during COVID-19, the key precautionary measures were minimizing activities outside their house and garden, strictly avoiding any kind of public gatherings during the period of COVID-19, and completely avoiding contact with people showing any kind of COVID-19 symptoms. Moving ahead, we also saw that around 80%, more than 60%, and around 50% of the parents sanitize their homes and their child's room or play area on a daily basis. This slide shows knowledge about extra precautions that the child has to follow when the parents are not around due to COVID-19, and the ability of the child to follow precautions. So majority of the parents agree that their child have good knowledge about the extra precautions that he or she has to take when the parents are not around. And also majority of the parents confirm that their child have good ability to follow those precautions when the parents are not around. Moving towards the next slide, which shows adaptation of government recommendations. So the first graph depicts that adaptation of parent and family of government recommendations. Majority of families had strong recommendations of, strongly adapted the recommendations. The second graph depicts the adaptation of people around child towards government recommendation, and we can see that parents felt most people around their child also had good adaptation towards the government recommendations, however, less so than in close CF family units. Finally, moving towards the discussion, so overall, more than half of the parents deferred their child's hospital visit for a period of 3 months. However, some had to defer for a period of around 6 months as well. And the main reasons of deferral were either the hospital unit was closed or fear of coming in contact with coronavirus. This is of great concern as routine examination is the key to early intervention in infective exacerbations or picking up any other signs of clinical deterioration in children with cystic fibrosis. A large proportion of parents found online consultation new and they were very satisfied with this method. However, this method is useful only as a temporary measure, as routine examinations such as checking of weight, height, body fat percentage, or their lung function cannot be really done online. Therefore, physical examination method can never be replaced with online method in cystic fibrosis patients. Also, majority of people and parents found prescription via email a very useful method. And in this study, we also saw that a large proportion of parents confirmed that their children could follow COVID-19 precautions by themselves. Finally, findings from this study confirms that a large number of children with cystic fibrosis and their parents have been impacted due to COVID-19 in terms of postponement of their hospital visits. And to avoid this, an online method was introduced which proved to be very helpful for both parents and children. Prescription via email was also a very popular method amongst the participants, and majority of them found it very useful. This method could actually be used and continued post pandemic. And finally, I would like to thank the parents and children for participating in this study. And I would also like to thank Cystic Fibrosis Ireland and Health Research Board for funding this research. And thanks everyone for your time and attention.
Thank you very much indeed, Rini, for a very interesting presentation. So one of our attendees has asked if you could say a little bit about how this amazing set of information and set of data that you've collected, how is that going to be used? What will you be able to, how will you be able to implement some changes resulting from this?
Okay, so we'll be actually, this is not the whole data. We had a very big questionnaire. We have other objectives as well. So after analyzing all the objectives and all the question, we'll be feeding back these results to Cystic Fibrosis Ireland, which may be giving these results to the clinics. Cystic Fibrosis Ireland is working very closely with the clinicians and the multidisciplinary teams such as physiotherapists who are working. So maybe they'll discuss these results with the Cystic Fibrosis Ireland team can discuss these results with them, and they can then see what improvements can be made. And also, Cystic Fibrosis Ireland may update their website with these results as well. So, yeah, we'll be giving majorly the results to cystic fibrosis.
Thank you very much indeed. I just see. Okay, sorry. And I see another question has just come in. Do you think children with cystic fibrosis should be considered priority during the vaccination rollout?
I think yes, because children with cystic fibrosis are at, at a very vulnerable, they are very vulnerable to to COVID-19, and they are amongst the group, along with these nurses and the healthcare staff. Children with cystic fibrosis will be prioritized along with the people who have, undergoing any disease.
Okay, really, thank you very much indeed for a very interesting presentation. And we've reached the time for our morning break. We're running ever so slightly behind time. So could I ask you to take a 10-minute break and rejoin us at 10:45, please? Thank you
Thank you
very much.
so much. Yeah, thank you.